Dr.Soebandi Jember Hospital, there was a 65-year-old male patient named Mr. Yanto, who came to the hospital 2 days ago and was accompanied by his wife and son with complaints of chest pain, shortness of breath, and body weakness. He's also an active smoker in the last 2 years. After inspections were made at the emergency room, the patient was transferred to the hospital. While in the hospital, the doctor suggested an X-ray radiology test to see what was wrong with Mr. Yanto.
Excuse me, good morning. Good morning, nurse. Let us introduce ourselves. My name is Nurse RATNA, and this is my colleague, Nurse NILA. We are students of Stikes Dr.Soebandi Jember. We will take care of RIFKI today. If you need our help, please call us. We will help you.
Okay, nurse. Is this true with Mr. RIFKI? Yeah, it is, nurse. I'm Yanti, the wife of Mr. RIFKI. That's a nice name, Mrs. That made me ashamed, but thank you, nurse. You're welcome. If I may ask what Mr. RIFKI is called? Just call Mr. Yanto, nurse.
May I know the age of Mr. Yanto, Mrs.?
My husband is 65 years old.
I will stay here. Can I speak to Mr. Yanto for a moment, Mrs.?
Yes, please, nurse.
How are you feeling today, mister? Are there any complaints?
I still have chest pain, shortness of breath, and debilitating body pains, nurse.
That must have been terrible.
Sir, nurse.
How many days have you had the symptoms?
It was 3 days before.
Okay, thank you for your complaint. But at the afternoon, we will be back with Dr. Tiara to bring Mr. Yanto X-rays.
Okay, nurse.
Please, Mr. Yanto, get some rest first.
Yes, nurse.
Good afternoon.
Good afternoon, nurse.
As I promised this morning, I come with Dr. Tiara.
I'm Dr. Tiara. How are you feeling today? Are there still complaints?
I have shortness of breath, horrible chest pain, and also very tired dog. I still urinate and get muscular sweat every night.
So, does my husband have a serious illness, Doc?
Sis, so calm down first. Based on the X-ray, Mr. was diagnosed with the disease coronary heart.
No, it cannot be. Surely the result is wrong. Check again, dog.
Mr. Yanto and wife, please calm down. We have checked twice that the result, the X-ray is correct.
Is it true, nurse? Then, what about my husband? Can my husband cure?
Thankfully, Mrs., there are the first 2 treatment through surgery and the second control or check-up every month.
If the operation is performed, will it be expensive? And are there any risks after doing the surgery?
Because he is old, the risk is likely greater.
Oh no! Then how much control costs each month? Does he have BPJS?
Yes, he does.
Then you stay calm. You can use the BPJS for any control, Mrs. Then let me discuss this with my husband first.
Okay, please talk about it first. If there is a decision, meet me at the doctor's office.
Yes, doctor.
Keep calm, mister. There is a way you can definitely recover with your effort, and don't forget to keep praying.
Yes, nurse.
Okay, mister. Later in the afternoon, I will come back with a nutritionist to provide information about foods that are allowed or not to be consumed.
Yes, nurse.
Good afternoon, Doc.
Afternoon, Mrs.
I came here to let you know what my husband and I have decided about the dog's treatment.
Yes, please, Mrs.
My husband and I choose to control every month dog because an operation was too risky for my husband. I was afraid something would happen to my husband.
Okay, Mrs. If that is the session you choose, I will make a control schedule for Mr. Yanto.
Okay, doctor.
You can go back to inpatient room first. The nurse will come back with a control schedule.
Yes, doc. I'll be leaving now. Thank you.
You're welcome, Mrs.
Good afternoon, Mr. Yato.
Good afternoon, nurse.
How are you, mister? Have you feeling calm down?
Alhamdulillah, nurse. I feel a little calmer. It's me. I know where I get coronary heart disease, nurse.
There are many things that can cause coronary heart disease, including unhealthy eating patterns, lack of activity and unhealthy lifestyle, such as smoking and consuming alcohol, which can also be a contributing factor for coronary heart disease that you experienced at this time.
Is it true of cigarettes? I don't believe.
Yes, mister, because smoking can clog the system in the heart so that blood cannot flow to the heart. Did you previously smoke?
Yes, I have been an active smoker for the past 2 years.
Then you better to stop smoking because it's dangerous.
No way, nurse, because smoking makes me in a good mood.
Yes, I do, but that's a real danger to your health, especially in your current condition. My husband found it hard to quit smoking. Yes, I know it, but it doesn't hurt to try for Mr. Yanto on good. You can do it, right?
It is difficult, nurse. Maybe I can try.
I broke along the control schedule that the doctor had set up. When my husband can start a control, nurse? You can start control next week on the 1st of every month.
Yes, nurse.
Do you have another question for me?
There are no nurse.
Alright, mister. The nutritionist will be coming to see you in a little while. Yes, nurse.
Excuse me, good afternoon.
Good afternoon.
My name is RETNO, a nutritionist at Soebandi Hospital. My purpose here is to inform you of a meal that can be consumed by a coronary heart patient.
Yes, please.
I brought a list of things to add and not to people with heart disease. You cannot have fast food here like fried chicken, burgers, and fries.
Is it okay to eat shrimp or coconut milk?
Sorry, I don't think you can because these foods contain cholesterol and high in fat. And you also shouldn't get foods that are high in sugar.
Then, what can my husband consume?
You can consume foods such as vegetables, nuts, and fruits.
How about fresh fish? It is okay to eat fresh fish?
Of course, mister, you can eat fresh fish like tuna, sardines, and salmon.
So like that?
Is there anything else you'd like to ask?
No, thanks for the information.
Yes, you're welcome. You can take this list of foods. Then, excuse me, I hope you get Wilson, mister.
Yes, nurse.
Do you understand now?
Yes, I do, nurse.
If you understand, so excuse me, my colleagues will be back with the pharmacist to bring the medicine.
Okay, nurse.
rescheduled appointment this afternoon. I came with a pharmacist to explain the medicine administration procedure.
Excuse me, Mister. I am Pharmacy PUTRI, here explaining the medical procedure for you.
Yes, nurse.
The first drug, epidurochromate bisulfate, is a drug for the heart. This drug includes heart drug with a doctor's prescription. These drugs are taken once a day at noon and taken after meals. The second drug, beta blocker, is consumed 2 times a day. This drug has the side effect of frequent urination. You can take it in the morning and at night. The third substitution drug is taken 3 times a day after meals.
Should this medicine be drunk until it runs out?
This medicine must be taken until it's run out. After the medicine runs out, you have to control it every month.
Okay, I understand.
Okay, is there anything you want to ask again?
There is no nurse.
If you have any question, please ask the nurse.
Alright, nurse, thank you.
How do you feel, mister? Do you understand?
Yes, nurse.
Okay, if you understand, excuse me. Tomorrow we will come back to check on Mr. Yanto.
Yes, nurse, thank you.
Sekian video dari kamu.